Okay, I think we'll get started, and I'm sure some people will be joining us as we continue through the session. Sorry about that. Good morning or good afternoon, everyone. Our afternoon is upon us here in Ontario. It's good morning to some. Welcome to the fourth and final day of the CanWatch Academy. And today's session, I believe it's the second last session of the Academy, Engaging Men and Boys for Gender Equality with World Vision Canada and Equimundo. I'm Charmaine Crockett, Director of Stakeholder Engagement at CanWatch, and I wanted to thank everyone for joining the 2023 Academy. Some of you have been at other sessions, and we thank you for being a repeat attendee. Today's session is being delivered with the support and partnership of Global Affairs Canada. I'm joining you today from Portland, Ontario, on the traditional territory of the Algonquin people. While we're meeting today on a virtual platform, I'd like to share my gratitude and respect to all Indigenous peoples from all nations across Turtle Island. They are the traditional guardians of the land upon which we live and work, and I acknowledge their longstanding relationship with this territory. Before diving into the session, there are a few housekeeping notes I'd like to share. Simultaneous interpretation is available in English and French. Please click the globe icon at the bottom of your Zoom screen to select your language of preference. This session is being recorded, and the recording will be shared in the coming weeks on our website. Today's discussion will include a question and answer period. Our request and preference is that you save your questions towards the end, and that you raise your Zoom hand found in the bottom of your screen and ask to come off mute and ask your questions verbally. However, we understand that not all are comfortable about speaking in a webinar, so you may pose your questions in the Q&A box. You have two different boxes. There's a Q&A box, because this is a webinar, and there's a chat box. So please post your questions in the Q&A box, and the presenters will do their best to answer your questions by the end of the presentations. If you are having any technical difficulty during the discussion, please write a message to Tina La Rochelle in the chat box. It is now my pleasure to introduce Meredith Holt-McKenzie, Sophia Papastavrou, Natalie Fisher-Spalton from World Vision Canada, and Vessel Vandenberg from Equimundo. We are very grateful that they took the time to share this important guide, manual, and toolkit that they have developed for engaging men and boys. And I look forward to a very engaging session with them. Thank you very much. I will now turn it over to you.
Thank you, everyone, for joining us today. My name is Meredith Holt-McKenzie. I'm the Senior Gender Equality Advisor at World Vision Canada. And I'm joined by my colleagues, Natalie Fisher-Spalton and Sophia Papastavrou, who are both gender technical specialists, forgive me, at World Vision Canada as well. And Vessel Vandenberg from Equimundo Center for Masculinities and Social Justice. He is the MenCare officer at Equimundo. I also want to acknowledge our colleague Socorro Maminta, who will be joining us for the Q&A period at the end. Socorro is also a gender technical specialist at World Vision Canada and is the lead for MenCare at World Vision Canada, and was the key developer and producer of the manual, the facilitators training manual. I think I've skipped over the agenda, but we will have an intro to the MenCare Program P from Vessel. It was developed by Equimundo and Sanke Gender Justice, and he will speak into that. And then Sophia and Natalie will share about the manual itself, and we'll finish with a period for Q&A at the end. Again, just a reminder, if you're able to put your questions into the Q&A box or tab at the bottom of the screen, that's great. And you are also welcome to take yourself off mute at the end of the session, end of all of the presentations, to ask questions. So it is my real pleasure to shift over to Vessel and welcome him to begin our session together. Thanks.
Thank you so much, Meredith. It's wonderful to join this panel and to be part of this conversation. I'm really excited to speak about the MenCare Global Fatherhood campaign with everybody. And I think we can go to the next slide. Thank you so much. So the MenCare Fatherhood campaign was launched in 2011, and we are now just coming up to 12 years in existence. And we are co-coordinated by the organization I work for, Equimundo, and by a South African organization that I used to work for, called Sonke Gender Justice, based in Cape Town. I'm speaking from South Africa, and I worked on MenCare. I'm one of the founders of MenCare when we launched it in 2011, and then I eventually joined Equimundo to Equimundo and Sonke has been co-coordinating the campaign since the beginning. Our vision is to see that men do half of the daily unpaid care work globally. And I believe this is a long-term vision. It might not happen in my lifetime, but I do believe it is a very necessary step for us to move forward as a world. I think a really important distinction to make, and you'll see the difference in the conversation that I'm in the slides that I'm also presenting, is between the MenCare Global campaign and the particular application of MenCare that World Vision has developed, called the MenCare approach or the MenCare project or MenCare program within this context. The campaign is much broader and the project is much more specific, but I'll get into that detail. Let's go to the next slide, please. So this is a very early picture from our very first global symposium, which we held in Cape Town. And this was the group of organizations. It was about 30 organizations and about 90 people who came together as the first group of MenCare partners to think through the values that should underpin the campaign. The next slide, please. And we have incrementally grown to have partners across 65 countries. We haven't recruited, our method of recruitment requires that an organization actually identify with the name MenCare, with the brand MenCare, with the identity of that and the values of that. So for an organization to use the name MenCare, to represent the brand, we do require a signing on to guiding principles, which are 10 value statements that I'll go into in a moment. But I wanted to say that the reason we are in 65 countries, we've got almost 100 partners. That's wonderful for us, but we could have had 1,000 partners by now if we had set the bar lower for participation. But we do feel that it's quite important that organizations who are going to be implementing MenCare actually believe in the values of the campaign. The next slide, please. So I'm not going to read through all 10 of the guiding principles, but just to mention that there are general value statements that are a combination of various human rights approaches, focusing, the first one I think might be interesting to refer to, which is just that gender equal parenting also holds benefits for men and men's well-being. It's often men are positioned, or in our work is often positioned as only being instrumental to women's rights and children's rights, which it certainly is. Involved fatherhood, involved caregiving by men holds multiple benefits to children and to women, but it also holds inherent benefits to us as men as well, in terms of our own mental health, our satisfaction in relationships, our competency in care, etc. There are multiple benefits to us as men as well. We also feel that care offers a positive alternative to counter the use of violence by men. So if you want to change behavior, it's often the problem is that we only say what we want people to stop doing, but we don't necessarily tell people what we would like them to start doing. And care is the alternative to violence, where we can explain and describe and train competent caregiving as an alternative to violence. That's not the only reason for care, of course, but in addition to saying, please stop using violence, one can also then cultivate a more nurturing and healthy set of relationships. The next slide, please. I think these also, just to say that, you know, the guiding principles are quite explicitly very inclusive, very supportive of diversity. We do support non-biological parents. We recognize diversity in parenting. In my country, in South Africa, for example, Only a third of children live in the same house as their biological father. But it's really interesting to note that almost 80% of children live with live with adult men. So it's about half. 1/3 lives with their biological father, but there's another third of children that live with men who are not their biological fathers, who could become father figures. And this is often a neglected area of investment and programming, where we are so hard at work trying to get biological fathers to come back or take responsibility, that we don't necessarily notice the other men in the caregiving network broadly who could be mobilized to become more involved. Of course, in terms of sexual orientation and gender identity, we also support diverse parenting and diverse parenting arrangements. And then we've got a very explicit advocacy agenda around paid parental leave for both parents, predominantly as a feminist agenda, but as I've said, it also holds benefits for children and men if fathers actually have the opportunity from work to become involved in caregiving. The next slide, please. So here is a snapshot of everything that our partners do and that we do. So I have spoken quite a lot about the values already on the left-hand side, which we expect partners well, that is the entry point for becoming a MenCare partner. But then we do advocacy projects, we do communications projects, we support the implementation of programs, and we have quite a extensive research program centered around the State of the World's Fathers Report and increasingly national countries' fathers reports. I will speak a little bit towards the end about the MenCare commitment, which is our advocacy instrument. But for now, just the next slide, please. Let me just focus on Program P, which is one program that emerged from the MenCare campaign. And next slide, please. So Program P, and what you can see on the slide now is the original Program P that was developed in 2011 by all of the organizations that are represented on the cover there, from South Africa, from Brazil, from Nicaragua, from Chile. Quite a few organizations came together and compiled a manual that supports men's engagement, specifically in maternal and child health. There's a group intervention element, but there's also an element of working with health service providers, in other words, the staff in health facilities. And there's also an element of helping implementers to develop community campaigns, so that the people participating in the group intervention also engage with staff in the facility that understand the value of men's engagement in antenatal health, but they also are engaging outside in a community where there's a parenting group, or there's a campaign, or there's a supportive space for the same norm to shift. It has since been adapted in over 30 countries, and the range of other pictures that you see on the slide are some of the different applications of and adaptations of Program P. The one on the bottom right is Bande Bereho, which is adaptation and implementation in Rwanda that we've done the most rigorous evaluation of. There was a RCT completed in 2016, and it found indeed that there was more support for gender equal attitudes amongst parents. What was really interesting was that there was a reduction in use of violence by men against women, but also a reduction of use of violence by men against children. And that, I think, shows the potential of a gender transformative parenting intervention, that it can reach multiple outcomes for women and children and for men in one intervention. The next slide, please. So what I'm sad that we are doing this now and not a month or two from now, because we are working on the final text of a global review of various Program P adaptations that's focused on a set of case studies that shares various lessons, and I'll mention them today. But please look out for that on our website. It will be published by the end of July. Thank you. Next slide, please. So I have described Program P a little bit. This is basically repeating what I've already said. I think we can go to the next slide already, please. And again, I think this Yeah, there we go. Thank you. So the slide we're looking at now is from that review of the adaptation in various countries. I do have to say that, you know, when we started working on Program P in the early days, a key goal for us was to see that Program P becomes institutionalized. I don't like that word very much, but perhaps integrated or embedded is a better word, that the program becomes a component within a broader institution. And we were focused on governmental institutions like health departments or social welfare departments, but also on larger civil society organizations. And I do think that the World Vision adaptation of Program P to become the MenCare approach or the MenCare project within World Vision is a successful example of exactly that, of an institutionalization of an organization that has made it your own and are implementing it. So I'm very, very happy to see that. Some of the components of success from the review is basically that there's a need for long-term partnerships with organizations that share a vision to implement the program, that there's also intersectoral engagement with governments and with civil society, and that the methodology is actually based on social learning, where there's a continuous iteration to make the program more effective. Next one, please. I also have to say that the investment in the right facilitators cannot be overemphasized. Taking the time to actually, because gender attitudes take a long time to shift, it's rare to meet somebody who hasn't gone through a gender transformative process, who actually understands the need and the values and the language and the vocabulary around that. So there's a really important component of taking the time either to develop people's understanding of gender equality, or to take the time to actually find people who already have that. And then I think also, I have mentioned this before, but just to make sure that the program is not isolated within an evaluation study but I think an ADP, area development program, is a prime example of how a program can be embedded in a broader institutional framework. And again, you know, it will be wonderful if we have the long-term funding from donors who see the long-term vision in making change. Next one, please. So towards just coming up to the end of my contribution, at the beginning when I spoke about MenCare, I did mention that we are doing advocacy component as well. What we're looking at now are a set of commitments that we are working with companies, corporations, private sector employers mostly, who are committed to making workplaces more supportive of gender equality in the workplace, but also at home. As you might know, there is a phenomenon called the motherhood penalty, or sometimes called the childhood penalty, where mothers are significantly compromised in terms of earnings and salary, but also availability for work, mostly because of care needs at home. And one way to counter that is to invest in women's leadership and skills at work. But of course, the care work needs to be picked up at home as well. So that's the logic behind the MenCare commitments. This is a set of policies, parental leave and others, that support the ways in which workplaces can be more supportive of men's care at home, mostly to achieve a more gender equal workplace. Thank you. The next one, please. So I'm at the end of my contribution. I'm really looking forward to hear about the MenCare approach within World Vision. We are recruiting partners. You are welcome to join MenCare, or if you're a company or an employer to talk to us about the MenCare commitment, please go to our website and click on the Get Involved button. And I really look forward to engaging with you. Thank you so much to World Vision for the opportunity to speak, and I look forward to continuing the conversation. Back to you, Meredith. Thank you.
Thanks very much, Vessel. There was a question as to where resources from the MenCare, the global MenCare campaign can be found. There's resources available both on the MenCare website, that's mencare.org,
I'll post the links.
Great, thank you. And then also there's resources on Equimundo's website, and very soon the manual that we'll be presenting will be also available on World Vision's website. So I would like to now pass the chair over to Sophia and Natalie. I'm not sure actually who's going first, so I will go on to mute. Thanks.
Sure. Good afternoon, everyone in Canada. I'm coming to you from Cyprus. If you don't know already, World Vision has a Middle East and Eastern Europe regional office here. And I am very excited to be here. I just wanted to take a minute to again acknowledge our lead on the project, Socorro, who's here today and will be also free to answer questions as well. So without her leadership, I don't think we would be here today. And I'm very excited to share the MenCare manual with you. I'm going to start by presenting 3 of our MenCare resources that World Vision Canada has developed in the past couple of years. I think it's really important to start off with that. These resources are based on results from the review and assessments of the implementation of MenCare and male engagement approaches in 3 of our major grants funded by GAC, Global Affairs Canada. This is part of our effort to build our portfolio of evidence and learn around the engagement of men and boys for gender equality. Next slide, please. So the first resource is entitled Increased Male Involvement in Women and Children Focused Development Program. So it's the impact of MenCare approach in enhancing nutrition services to improve maternal and child health in Africa and Asia programming. So this particular document assesses and explores implementation of the MenCare approach by our World Vision Canada partners within our national offices in, the Enrich program. So this was a project for the advancement of reproductive, maternal, newborn, and child health and nutrition in select regions of Bangladesh, Kenya, Myanmar, and Tanzania. The assessment base is based on qualitative field research that sought to uncover key results and critical success factors, as well as identifying our lessons learned. And this has informed future World Vision Canada programming related to male engagement and gender equality, along with, the values of this initiative on RMNCH nutrition. The program was assessed using the Organization for Economic Cooperation and Development's evaluation criteria, namely for relevance, effectiveness, efficiency, impact, sustainability, and coherence. Next slide, please. Excellent. Our second resource is Engaging Men and Boys in Reproductive, Maternal, Newborn, and Child Health and Nutrition Initiatives, its impact and lessons learned from 3 World Vision Canada programs. So similar to the first one, this resource examines World Vision's implementation of MenCare, focused on improving RMNCH nutrition outcomes based on the experiences of those 3 grant projects in Africa and Asia. That included Enrich, from 2016 to 2021, and 2 other RMNCH focused projects. One was supporting systems to achieve improved maternal, newborn, and child health, SUSTAIN, from 2016 to 2021, and that was implemented in Kigoma, region of Tanzania. And the other one was Born on Time. It was a project focused on the prevention of preterm births, and Born on Time went from 2016 to 2021. And it was implemented in Bangladesh, Ethiopia, and Mali. Now, this report was informed by a review of the project documents, or reports and evaluations, interviews with project staff, particularly for SUSTAIN. And in the case of Enrich programming, qualitative field research through focus group discussions and key informant interviews, circled back to interviews with men, women, local leaders in select project areas. Now, drawing on the latest evidence-based research on engaging men as allies for gender equality, the 3 projects adopted similar strategies to build and leverage men's awareness and sense of responsibility for the health and well-being of their wives and their children. Next slide, please. So the last and final resource, entitled Engaging Men as Active Partners of Change for SRHR for Women and Girls Through Male Engagement Groups in Amhara, Ethiopia. This resource was based on a separate review of Born on Time's implementation of male engagement approaches with the overall objective of preventing preterm births by targeting risk factors related to nutrition, lifestyle, limited access to contraception that can, of course, lead to babies being born too soon. So given the role of men as power holders and gatekeepers of customary or established values and practices, which are sometimes harmful, the project engaged men to become active partners of change for gender equality, to improve SRHR for women and girls, and to prevent, preterm birth. So the report documented shifting of participants' beliefs and practices towards gender equality and that reduction of the risk factors that contribute to preterm births, such as child early forced marriage, SGBV, IPV, and excessive workload attributed to those men engagement dialogues. Next slide, please. Awesome. It's important at this point in time to really delve into what we call the Enrich experience. That particular program, some of the golden nuggets here that I want to share this afternoon with you, it was improving the health and nutrition status of mothers, newborns, and children in selected regions, as I mentioned prior, Bangladesh, Kenya, Myanmar, and Tanzania. There was strong societal and cultural resistance to male involvement at that period of time as contributors to family health and well-being. Next slide, please. And men's accountability and engagement to influence positive decision-making. We also saw a focus on health-seeking behaviors that use of reproductive health services. Now, a practical tool to engage men as allies in advancing gender equality and women and girls empowerment. Next slide. Great. Within our preliminary gender analysis, we saw that there was poor nutrition outcomes, discouraging both young adults and men from taking equitable responsibility for domestic and child work. We saw that there was engagement and from engaging MNCH related issues. Next slide, please. The analysis concluded that constructs of masculinity, of course, challenge for women and girls to live fully and to see real and lasting improvements in MNCH outcomes. And men need to be engaged as allies and active participants in that transformation. And Bessel had really nailed it when he said, the state of the world's fathers. That report, I think, is really crucial as well. But then the game changer here for us is the MenCare manual. It was that facilitator's tool to implementing and engaging that particular intervention, with Enrich in the Enrich project. Excuse me. Next slide. So in response, what did we do? We engaged men in programming areas to increase decision-making power of women and strengthen those SRHR to improve MNCH outcomes. We also engaged, again, what World Vision Canada or World Vision across the partnership does excellently well, phenomenally well, is that religious leaders, engaging with religious leaders, predominantly men, of course, of various faiths on MNCH, nutrition issues, and on the negative impacts and effects of harmful social cultural practices that we've seen in those communities, and enriched countries working together to strengthen the MenCare approach as critical strategy for achieving program goals. And so what the result was, and I'm going to pass it on to my colleague, Natalie, to share with you where we headed and what the result was. Thanks.
Thanks, Sophia. Yes, so as Sophia has shared, it's really from these learnings from our projects, and particularly from Enrich, where the MenCare manual was developed. Certainly building on the resources, the wealth of resources that Equimundo have developed. And I think we're going to be putting a link in the chat to the manual so that you can all take a look at it. But just I'm going to take a few minutes now to walk through some of the aspects of the manual and how it can be used in creating men's groups. To work with them as their role as being allies in gender equality. So some of the key objectives of the manual is really to be engaging men in effective ways to reduce gender inequalities, to promote health and well-being of women and girls and families, to end all forms of gender-based violence, for fathers to benefit by developing closer and more emotionally connected relationships with their children, and to build stronger bonds with other fellow fathers over their shared experience of fatherhood. The manual and this approach gives men all the freedom to question dominant ideas about manhood and or fatherhood, and to really be questioning and redefining masculinities, denouncing violence, promoting the respect of women and girls, promoting shared decision-making power and control over household resources, equal valuing of girls and boys, and really building that sense of allyship and being an advocate for gender equality. So the manual is structured over 10 sessions, and it aligns with the principles of MenCare that Vessel shared earlier. And each session is designed to be interactive, to be participatory, and it's through targeted activities and group discussions, covers a range of topics on gender equality, pregnancy and birth, sexual and reproductive health and rights, around caregiving, violence and alcoholism, shared decision-making, and participants learn about the critical role they play as in their different roles as husbands, fathers, brothers, sons, uncles, colleagues, etc., in advancing women's rights. And it's also important to note that it's really key to adapt for every program area where this is being used. Each community is different, so it means it's important really not to just be taking this as an open and implement exercise, but it really needs to be tailored to the needs and challenges and the context where it's being used, to ensure that it's really covering the most pressing issues, the most relevant challenges, and also tapping into the local opportunities. So a few guidelines to build on that is in order to really be contextualizing, is to be, we suggest to conduct focus group discussions and in-depth interviews so that key insights from participants' lived realities can come forward, how they divide their roles and responsibilities in the household, looking at different identities of what it is to be considered a man, a woman, or a non-binary identity, and what they see are the barriers to this. It's also important to note that if the facilitator of these groups is from the community where it's being implemented, it's important not to take for granted that he or she knows all the issues on which to focus. So again, it's really being conscious of contextualizing, doing research, just as a facilitator who is coming in from outside of the community would do, to ensure that it's well-informed and current and up to date. And it's also important to note that while the manual includes sessions that specifically aimed at fathers or future fathers, it may not be relevant for all participants. So looking at who should be a facilitator, some of the points, and this is included in the manual, and I think Vessel also touched on this, on who's leading these kinds of groups. Really, the facilitator needs to be knowledgeable about gender equality issues around sexual reproductive health and rights, including sexuality and masculinity, and how these affect attitudes, norms, behaviors, and power dynamics. It's important for facilitators to understand gender norms and how inequalities affect men and women's opportunities and vulnerabilities in society. And facilitators should really be aiming, and for these groups to really be considered to be safe spaces where everybody is comfortable and safe to express themselves, their ideas, and to feel free to learn in that kind of environment where we're wanting to create alternative gender equitable behaviors. And facilitators themselves may need to challenge their own held beliefs about gender, which sometimes can be uncomfortable. So from using the MenCare approach, some of the factors and lessons learned from World Vision's implementation of this in our projects, we've found that it's also important to include a session around destigmatizing mental illness and knowing where and how to access support, and also other potential support systems and services in the community. It's also important to sensitize and be in communication with the partners and wives of the MenCare participants. This is something that we found is very important, so that the women in the communities are also understanding what is the purpose of these sessions and what they hope to achieve by their partners being part of the MenCare groups. It's important that we can look at expanding categories of men who are targeted by the program. So that could also include adolescent boys and older men. Sophia touched on, how to leverage men's religious faith and faith leaders to accelerate behavior change. And we've seen this to be an important approach. Conducting home visits to men by MenCare participants and community leaders, also finding ways to continue to bring in more men into these conversations and learning, and to continue to grow connections between MenCare and with local government authorities and community groups. So some of the other lessons learned would be around continuing this expansion of messaging and using social media, TV, radio to get some of the messages out. Ensure that training and group discussion, the content and behavioral change strategies are locally informed and are appropriate to the local context, as we've said. And that having role models come and share their personal experiences, that also has been instrumental in sharing their perceptions and attitudes and behaviors, and complementing advocacy and education related initiatives with concrete materials that helps communities to implement new learnings that can also contribute to the success of running MenCare groups at the community level. And finally, around some of the other factors are that RMNCH MenCare programs are strengthened by support from community, religious, and government leaders. It's really critical to get their buy-in and engagement. Success of the MenCare approach is really due in part to consistent messaging at every opportunity to be telling the story and getting the messages out. That it's focusing also really helping men to see that there are so many issues where they can exert control over their lives and in their families, to make use of their interests that are appealing to men, and ways to also reach out and outreach to men by finding them where they are, whether that be in coffee drinking places or at football matches, board game competitions, and so on, finding ways to connect with them. And also, as we touched on, just the importance of engaging with women in the behavioral change aspects of the MenCare groups from the outset, to get them on board and understanding the purpose of the groups. And since trained facilitators tend to come from the same community where the groups are being run, the good side of this is that MenCare participants then can often feel more open to sharing their experiences during the dialogue, because there is a certain level of trust from that connection. And also to sustain the male engagement, the program really, if having it embedded and connected to local health systems and community structures, is also a way to further the effectiveness. So that's my side of things, and I'd like to now pass it back to Meredith for the Q&A. Thank you.
Thanks very much, Natalie, Sophia, and Vessel for this amazing presentation of engaging men and the different strategies. A lot of material has been shared, a lot of resources have been shared in the chat function, so you can find those there. just thinking about some of those lessons that Natalie was just going through, those are related specifically to the assessment reports and more in-depth reports that Sophia was referencing. So there's a lot to kind of dive into and to get your, to sort of explore a little bit more about what our experience was implementing this, and certainly what led to the success, particularly on the Enrich project. There's been, I'm going to, first, there is a question, I think Natalie might have the answer to this question about when the manual may become available in French. I think I might know the answer, but I'm going to throw that back to you. Oh, you are muted, Natalie.
Oh, is that okay?
That's perfect.
Okay, because I'm getting a thing that says that I'm muted. Anyway, sorry. The manual is actually being translated as we speak into French. So we are hoping to receive that actually in the next few weeks, and then it will be going to the design layout stage. So we hope to have the French version of the MenCare manual sometime later this summer, let's say August to September, I would say, and we'll be adding that to World Vision Canada's website.
Thanks, Natalie. And there's another question that's come from Action contre le well, gosh, I'm terrible in French, so I'm not even going to read that in French. I'm so sorry. But the question reads, do you think feminist women-led organizations should put forward programs to promote positive masculinity, or should these initiatives come from men-led organizations? And I would like to throw that back to Vessel and see what his thoughts are on that. And then if either Sophia and Natalie have a thought on that, feel free to jump in after Vessel.
Sure. My answer would be yes. So yes, both and. So yes, women, feminist women-led organizations. And so I think there's two relevant points to raise there. So the first one is, particularly in terms of men's use of violence. Of course, that violence is often informed by experiences of trauma, and dealing with that trauma is one way to reduce the likelihood of using violence. And that realm of working on men's vulnerabilities is often located within male-focused organizations that work on men's healing as a way to both improve those particular men's lives, but also then, of course, it leads to a likely reduction in violence. That's a long-term, deep, slow process. It's not a quick fix. It's not an intervention. It actually needs a proper psychological intervention. The risk with that perspective in the context of working with men for gender equality is that becomes, in a feminist approach, that becomes the main goal, is that it becomes the means becomes the end. And what we often encourage, both within MenCare and Equimundo, is that work happens in a gender synchronized way, so that an intervention like MenCare is implemented, I think also even at the participant level, to make sure that women are not only accompanying men who are going through a behavioral process, but are actually participants. So Program P has been implemented in a variety of ways. One of them is that it's implemented as a couples intervention or as a mixed sex intervention. I do feel it is a little bit risky to say that a male-led organization should implement a program on positive masculinities, but I do think that in the context that I have spoken about, dealing with men's vulnerabilities, that it might be useful. But having said that, the overarching majority has been feminist-led, women-led organizations who have recognized the need to incorporate men in this agenda. Raising voices in South Africa or in Africa, there's lots, but it does feel that it does need to happen as a gender synchronized approach. Thank you.
Thanks, Vessel. Natalie or Sophia, do either of you have anything you'd like to add to that?
Sure, I can. Thank you, Vessel. I agree with you on that. I was just thinking that feminist-led organizations offer a very specific or particular lens, and Also, they have what I would say is a very strong intersectional lens as well. And I think can offer, again, that we did this in our MenCare manual and our MenCare approach in Armenia, where we were working on a project on sex selection, excuse me, and so that women and men, so parents, where we were working with them in sessions, and I think that there is a strength there, and I think that it's important to integrate, and I think it's important to combine. I think both organizations, whether it's feminist-led, male-led, et cetera, have a very specific role to play as well. And I think that, again, I'm going to add this other piece of organizations that are Christian-based as well, like World Vision, also have a particular role to play in the building of trust with religious leaders that really have a stronghold on these very specific faith-based communities and stronghold on these communities as well. And this gives us as a /Christian/humanitarian child-based organization the opportunity to go into these communities and do the work that we've been doing on MenCare. So there has been, decades of trust built with religious leaders, and that really has given us sort of a specific, let's say, understanding or sensitivity in the field. So I just wanted to add that. Thank you.
Thanks, Sophia. And I'd like to remind everyone, if you've got additional questions, to put them into the Q&A box or the chat, or to raise your hand. I'm also monitoring the participants if you've got your hand up. Although if I'm not seeing somebody and your hand is up, hopefully Tina can let me know. Tina or Charmaine can let me know about that. I'd like to actually ask Sophia, or sorry, Socorro, a question that Sophia just raised, and that's about the response of faith-based leaders. And I think it's important to note that World Vision works with MenCare, I believe has worked with both Christian and Muslim faith leaders. And so I'd be interested to know what has been their response and feedback on the MenCare approach. Maybe Socorro, as our MenCare lead, you can address that.
Yeah, thank you for asking the question, Meredith. I recall this experience we had with while implementing Born on Time, where we work specifically with faith leaders, and they participated in our MenCare programs or MenCare initiatives. And I actually interviewed some of them when I visited Ethiopia. The project was implemented in Ethiopia, and the faith leaders were very responsive in a positive way. They even shared some personal testimonies of how MenCare has changed their views and perspectives. For example, in relation to early forced marriage, where a faith leader said that, okay, I really repent what I've done with my very young girl, who I sort of forced to enter into early marriage. And so he said that he will never do that again to the other young girls that he has. So it's very positive. And they shared very powerful testimonies of the success of the MenCare approach.
Thanks, Socorro. I'd like to be interested. I'd like to ask both Vessel and Natalie, Sophia, Socorro about the impact of the pandemic. We've seen an increase in violence during the pandemic. There's been higher rates across the world, and I'm wondering whether or not there's been an impact at all on the methodology and the rollout of the MenCare approach. How has the approach been adapted in response to A, the pandemic, and B, that increase that we've seen in violence. So, I mean, I think overall we might have been seeing more of a decrease in violence, and the pandemic has really reversed that in many contexts. Maybe Vessel, I'll start with you.
Sure. Thanks, Meredith. I think so. Just on the global data, I think just it's worth mentioning in case people don't know this, but the amount of time spent on unpaid care work in the home increased both for men and for women. So men did more care work around the world during the pandemic, particularly during lockdowns. But on aggregate around the world, the gap widened even further. So while men did more, women did not only do more, they did still more than that. So for example, if men would do 1 hour more, women would do 2 hours more. So the gap widened even further, even though men were contributing even more. That's just on care work. One adaptation of Program P that we are now piloting in Colombia is called Paternar. It is a hybrid implementation. So it is a combination of in-person meetings with a intensive facilitation of a WhatsApp conversation. So there's materials, little pictures that you send to a WhatsApp group, and there's trained facilitators who are skilled in using a script, a prepared script as a material. So it's not a chatbot or a kind of an automated set of messages. It's actually engagement, both on a WhatsApp group and on in-person meetings. But their in-person meetings, of course, are much more spaced than they would have been pre-pandemic. So that's one thing to share. Let me stop there, and I'll pass the mic to Natalie. Thank you.
I think actually, I think Sophia is going to respond to that question.
Okay, sure.
Thanks.
Go for it.
Mine is a very short answer, because Vessel has sort of outlined some of the exact, the SGBV has exacerbated domestic violence, et cetera, since the pandemic began. We see an influx in unpaid care work and labor. I think what's been instrumental for us currently, and the need to roll out the manual, we see an increase of the MenCare approach being integrated and used in our projects, as well as our development of proposals. I think that has been sort of an integral component of our programming at this point in time, is to really use the approach, as well as include within our SGBV guidance, including it in our campaign awareness campaigns, as well within projects. And I think that has been truly instrumental for us overall since the pandemic began. So I just wanted this very short answer. Thank you.
So we're nearing 2 o'clock. I'm just going to ask one last question, unless additional questions pop up in the chat. And that last question is to just if folks could think about any of the backlash that's been observed in implementing MenCare. So, there's cases where, where women have been very offended. They haven't really appreciated the fact that men are now, I think the perception might be intruding into their territory. And men have also experienced backlash from other men, sometimes women, on, they're taking on more care work in the home. Wondering if Socorro, you could speak a little bit to our experience in dealing with that, and then maybe Vessel, if you've got some additional words to add to that from Equimundo's experience.
Yeah, sure. I can cite our experience again in Born on Time when we implemented the project in Ethiopia. So when we started organizing MenCare groups, the men started their sessions, like they had discussions every 2 weeks, and they were starting to learn a lot of things. And so this led to some behavioral changes. When they went home, they started cooking, and they started taking care of the young kids. They started washing clothes. And so there was a major backlash from their female partners, because the home is their domain. So that's where they consider they have power and control. And they were feeling that they are going to lose such control because of these MenCare discussions. And so what the project did as an intervention was also to organize female discussion groups, where the topics covered in the MenCare group discussions were also introduced in these female groups. And so at the end, the female spouses were on the same page, and they had a common understanding of what the MenCare groups were doing. And so this resulted to more smooth transition and smoother relationships between the spouses.
Go ahead, Vessel. Thanks, Sakura.
No, and I'm really happy to hear about that example, Sakura. And I think we've shared the same experience in Rwanda and in Brazil and in other countries where the gender synchronized approach really works well if you work with both genders together. I think 2 points maybe might be relevant. The one is that what we've also found is that MenCare might sometimes be hijacked as a way to reassert father's rights as the head of the household at the expense of gender equality. So it's not quite a backlash, but it's kind of a subversion of the approach. So the emphasis on gender equality as a core value is really important. And then secondly, I think the care is often identified as a feminization or a female value. And we're seeing a lot of that, especially in the US at the moment, with the way in which men's engagement in care is seen. Just the emphasis on care as a non-gendered activity is really important as well. I'll stop there. I see our time is out. Thank you.
Thanks, Vessel. That's a really interesting reflection, actually, on some of the trends that we're seeing here. I also remember having conversations with you previously about some of the trends that we're seeing in terms of different age groups. So ironically, older age groups having a greater sensitivity or interest in gender equality, and younger men having more of a disinterest in gender equality. That is a whole other topic that I feel that we should explore at some point. But I'd like to thank my colleagues, Natalie, Sophia, Socorro, for their participation in this discussion just now. And Vessel, thank you as well. And I'll pass it back to Charmaine. Thank you.
Thank you so much. Thank you, Meredith, Natalie, Vessel, Sakura, everyone. Thank you so much for an amazing presentation, for taking the time today and sharing this with us. Everybody will be looking forward to more. I think this is going to be highly useful, and we're very fortunate again. Thanks to everyone for joining us, and hope everyone has a great rest of their afternoon. Many thanks. Thank you, everyone.
Thanks, everyone. Bye-bye.
Thank you. Bye-bye.